All right. Good morning, everybody. Thank you very much for heeding our call for this seminar. Thank you very much for joining. Thank you for participating in our presentation today. This is Dr. Mishili, and I'm going to be your host and your presenter for the program. While we are here, could you please tell us where you are joining from in the chat? And for those on YouTube, you can also just type. All right. So please, you can in the chat, you can tell us where you are joining us from. All right, waiting for the chat to load. All right, please tell us where you are joining us from. Thank you very much, Onyekachi Okoro, joining from Ibadan. It's an honor to have you here with us. Waiting for others, please. Let's just tell us where are you joining us from today? Where are you joining us from for this seminar? Right. We had a lot of people register from different countries of the world. Just type in the chat. We'll be able to follow your message. From Nigeria, from United States of America, from Pakistan, from Kenya, from Ghana, from South Sudan. Yeah, Alima from Lagos. Thank you very much for joining. We have Timileyin from UCH Ibadan. Thank you very much for joining. We have Trimore from Zimbabwe. Thank you very much for joining. We have Awe Ayolua from Oyo State, Nigeria, Ibadan. Thank you very much for joining. All right. And Simon Gadiat from South Sudan. Thank you very much for joining. All right. So once again, you are welcome to this seminar. And the goal of this seminar is to provide you, researchers, professionals, with an understanding of the OECD-DAC criteria, which is the gold standard framework used globally in program and project evaluation. My name is Idowu Mishi. Like I told you, I'm a data analyst and a research consultant with more than 10 years of experience in research consulting. I've been privileged to work with various organizations across different countries, including USAID, Palladium, UKFCDU, UNICEF, among others. And I currently work as the lead consultant and head of operations at Project Partner Data Solutions, which is a research consultancy that is situated here in Nigeria. And our organization provides 3 core services. We do research consulting, training, and field training and project management. And part of our evaluation work is conducting end-to-end evaluation, baseline, midline, and endline evaluation, impact evaluation, process evaluation, and we work with different tools, include mixed method research methods like quantitative, qualitative, and a mix of 2 desk reviews and all those stuff. So it's something that we enjoy doing, and we have a strong team that we work with. Thank you very much, Aramide from the United States of America, Adeola from UCH Ibadan. Thank you very much. So the purpose of today's training is to explain the purpose and origin of the OECD-DAC criteria, to establish and distinguish each of the 6 criteria, to formulate evaluation questions, formulating evaluation questions that are aligned with the criteria, to help you to identify methods and data sources per criterion, and how you do to apply this criteria in real world. I first came across this OECD-DAC around 2019. My research mentor, I have to adopt my research mentor, Dr. Olujide Arije, was the one that actually I came across this tool on the job. It wasn't something that I got to know where I had this kind of structured training. I didn't get the opportunity, and So it's a privilege to be able to share this with you at this time. So I first got to know it through him when we had to carry out a work in, that should be in Taraba State, Nigeria. And at that time, so I asked him to go and just go and read up on it because we are going to do a process evaluation then. And I was like, okay, what is this thing? I read about it, and then I developed the tool, and I had to lead the team. We came back, we carried out another evaluation in Osun State. Again, I had to lead the team. And over time, I've been involved in a lot of evaluation, baseline evaluation, midline evaluation, endline evaluation. So eventually, recently we had to work with Mexico Corps, and we met this tool again. So it got me asking questions. What exactly is this thing? And thankfully, eventually I had to sit down and put the entire thing together because it's something I've been doing for more than close to 10 years. But now I've been able to put it together in a name, and now it's an opportunity to be able to share this with you on this platform. So when we talk about evaluation, program evaluation is a systematic and objective assessment. Please, if you are on mic, could you please help to mute your mic? Please, I want to encourage everybody, if possible, try and take notes because we have said we will not be making the recording available. But so try and take notes, but we'll be sharing a very important toolkit that you'll be able to work with by the time we are done. So program evaluation is a systematic and objective assessment of an ongoing or completed program. Excuse me. All right, can you please confirm that I'm audible? All right, thank you very much. I think I have gotten that handled. So program evaluation is an objective assessment of an ongoing or completed project, program, or policy. In evaluation, you check the design of the program, you check how the program was implemented, and the results that the program eventually achieved. Now, I want to tell you that program evaluation is not something you just learn for when you are handling a big project. In fact, if you are going on something that you have to, maybe you got a funding for something or you are trying to accomplish a goal, it is something you learn to do again and again and again till it becomes a part of you, right? For example, we have different types of evaluation. We have formative evaluation, which is done at the early stage, at the early implementation of a program. Like last year, I was in Sokoto and Kaduna State on the formative evaluation for a program that was going to be implemented in that area, right? Then we have process evaluation, which is implemented while a program is going on to check whether the program is in line with what it is meant to achieve. We have summative evaluation, which is conducted at the end to judge the merit and overall worth of a program. Then we have impact evaluation, which is carried out to check how well a program has whether the long-term changes that are observed can be attributed to a particular program. All right. So now we talk about the OECD-DAC criteria. If you're very familiar with research, we talk about tools that we use in carry out research. For instance, I'm a psychologist. We do a lot of behavioral evaluation. We have a lot of skills that we use to carry out, like say, behavioral skills, personality skill. What other skills do we have? Personality skill, self-efficacy, and a lot of other things like that. We use all these tools all the time for our work. But the question now is that before you adopt a tool for a particular project, you have to be sure that the tool can actually achieve the purpose that it's going to achieve. Then we talk about the reliability and the validity of the tool, right? And what we usually aim for is to have something that we can use across different clients and be able to achieve the same result. So whenever people are applying these tools, excuse me, please. Whenever people are applying these tools, you don't just use them blindly. You have to be deliberate in asking questions. This tool we are trying to achieve, this tool we are trying to apply, this tool we are trying to use, is it the right thing? Is it meant to achieve the right purpose that it is set out to do? So that's where we come to this OECD-DAC evaluation framework. The program was, the tool was developed in 1991. as a like a gold standard to help organizations, to help development programs, to be able to evaluate how well the program has been able to achieve. Because if you don't ask the right questions, you will not know whether you have achieved the right result. So this is an effort to gather the right questions together so that we'll be able to achieve the right result. So the framework was adopted by the United Nations and several international organizations in the early 2000s. Afterwards, in the mid-2010s, there were further revisions and evaluation that, okay, what can we do better? What can we do differently on this scale? And then in 2019, a sixth criterion was added to it, which was the coherence. And so we eventually ended up with 6 tools. So today it is considered as the gold standard for development evaluation. The OECD criteria, like if you are doing a program, you want to say, has this thing worked? Has it accomplished the goal that it set out to accomplish? Instead of, so that you'll be able to ask the right questions, because it's possible to miss out on important questions, like what questions are we supposed to be asking? Where are you supposed to start from? Instead of reinventing the wheel, this has been developed as a framework that you can easily adopt, that you can easily reuse. And the good thing about it is that being that it is a standardized framework, you can be able to use it to compare across different programs, right? So we will be going over the 6 of them in the next few minutes, and I believe I'll make efforts to make it as simple as possible. I'm aware that some people in this discussion will probably have had encounter with this before, so I think it should be a good thing. Miss Sarah, if you are there, I believe that some people on YouTube may probably want to join us in the conversation here. So if you are on YouTube, Miss Sarah, can you let me just generate a quick QR code and send to me on WhatsApp so that I can share with people that are probably joining us on YouTube, so that they will just be able to follow the conversation. Probably they'll be able to get the opportunity to join us in the Google Meet, since the room is not filled up. But once we hit 100, we'll not be able to bring in any new people into the Google Meet. All right, back to what I'm talking about. So we'll be exploring the six thematic areas of the OECD framework. We have relevance, coherence, effectiveness, efficiency, impact, and sustainability. Before I proceed, you know, when I started with these two, I was like, which one is relevance? Which one is coherence? It's easy to get overwhelmed. It's easy to mix them up. It's easy to get lost trying to figure out, okay, which is which and which is not which. All right, so because of this, I will try and make it simple and easy to follow for everybody. All right, so we start with relevance. The first question, the first idea in the framework is talking about relevance. Relevance, say, is the intervention doing the right thing. So let's say that what are the questions you're supposed to ask for our program? We have 6 key questions that should cover everything that relates to the program. The first one says, is this intervention doing the right thing? We want to talk about, is intervention doing the right thing? For instance, if you have been able to follow our social media posts about the different case studies that we talked about. We talked about one of the case studies that related to relevance. You go ahead, you went to give people lanterns, whereas what they needed was water. So before you, like, the intervention you are carrying out, is it what the people needed? So for you to do this, one of the questions you can ask is, to what extent does it address the priority need of the beneficiaries? Right? You are a big man, you want to give somebody something, you now said, okay, I want to build airports in a rural community. So the question is, this intervention you are doing, is it relevant to the need of the rural community members? Do they need it? Is it going to meet their need? Or what could you have done differently? It's like, say somebody wants to do birthday. Instead of just going ahead and just buying a birthday gift for the person, you can say, what is your birthday wish list? That way, you'll be able to target your expenditure to the direct need of the person, instead of just buying randomly. It's just an example, right? So to what extent does it address the priority need of the beneficiaries? Another question is it aligned with national policies and development priorities? Does it match the mandate of the implementing organization? And how well was the problem understood at design stage? By the time we are ending this discussion, we will be able to do a live demonstration so that you'll be able to understand how to do this in your evaluation program. So one method you can use to evaluate relevance of a program is you can do a needs assessment, or you can do a baseline survey. Key stakeholder interviews or key informant interviews is one of another source of information. Document and policy reviews, focus group discussions, or participatory rural analysis. These sources can help you to be able to ask the right question with regards to relevance. All right, before I proceed, let me just get feedback. Am I making sense to you so far? All the things I'm saying, is it adding up? Is it making sense in your ears? Or I hope I've not lost you in at any point so far?
No, you have not.
All right, thank you very much. The next thing we are talking about in this criterion is coherence. What do you mean by coherence? Coherence means how well does this intervention fit with other initiatives? Okay, so we talk about relevance, talking about meeting the need of the people that you are meeting. The other question is, the people that are providing support for these people, does your program meet their needs? Does it make sense to them? Because if it doesn't meet their needs, they may not put interest in what you're doing. How well does the intervention fit with other initiatives? For this coherence, there are two key areas that are usually considered. We have internal coherence and external coherence. External coherence means that this your intervention, how does the component reinforce other programs of the same organization that is carrying it out, right? Then external coherence means, does it line up with programs, similar programs by the government or other actors in that field? For instance, let's take something that is being done by, let's say, for instance, your organization is focused on children, maternal and child health, right? Now you want to carry out a program on something that's related to, let me look for something, agriculture, food production. So the question we should ask is that, okay, this program you are doing, how does it relate to the objectives of the organization? Your organization is focused on maternal and child health. You want to do a program on rural infrastructure. You want to build road. And I say, okay, because you saw a donor that wants to provide money to build road, you as an organization that's focused on maternal and child health, you want to go and support building of road. How does it relate with your goal as an organization? That means you are doing something that is outside your normal scope of work. That's what we talk about coherence, right? Then so normally we say that internal coherence, the program you are doing should be coherent with the goal of your organization. It should be similar to what your organization wants to focus on. For instance, an organization called Christian Food Aid has the goal of providing food for people that are less privileged. They get funds from donors and sponsors and partners, and they provide foodstuff. Then they carry out a program on school agriculture, school farming. Now, these things are coherent because it still lines up with food production and providing food for the less privileged. That's an example of internal coherence. External coherence means that program you are doing must line up with the broader policy framework, like maybe state government, local government, or national government, or international programs. For instance, one of the key ways to get this kind of coherence is, does it line up with the Sustainable Development Goals? That's an example of external coherence. Or you are doing a program in a state, and is the government of the state, of the country, interested in that program you are doing at that point in time? You check. One of the ways to check it is to check the policy or program mapping of the government, do a stakeholder and network analysis, or document review, or comparative analysis. You can do key informant interviews or system and complexity analysis. You have to know, this program we are doing, is it coherent with other programs? Or are there unintended synergies or contraindications with other interventions. Because if there's no coherence in your program, you may have a problem with sustainability, you may have problem with stakeholder buying, and you may have problem with support, with funding. If your program is coherent with other programs, it's likely you'll be able to get further funding even beyond the scope of your program. It's easier to get buy-in from stakeholders. For instance, if you have a youth employment program, you can ask the question, does it complement or duplicate vocational training by other NGOs in the same region? Maybe other NGOs are carrying out the same program in the same region, right? If that's that, you have a coherence, but you have to be sure that your program is not duplicating what others are doing. Then does it align with the National Youth Employment Strategy, right? So that's the second criteria, coherence. We've talked first about relevance. Is the program relevant to the needs of people you are meeting with? Coherence, is it relevant to the priority goals of actors in the field? The third criterion is effectiveness. Effectiveness talks about whether the intervention is achieving its stated objectives, right? So we have talked about it's relevant to the people you are meeting with, it is coherent with the national policy. But the next question is it achieving the objective you set out to achieve? Because if you end up doing everything and the goals you wrote in your policy document, in your TOR, was not achieved, then you have not carried out what you plan to do. For instance, to what extent have your stated objectives and outcomes be achieved? What are the factors that contributed to or hindered the achievement? For which groups has the program been most or least effective, and how well does the theory of change hold up in practice, right? So one way to check effectiveness of a program is to do a results tracking against log frame. You can do also survey, talk to people that are participants of the program. Do you think this program was effective? And so from their conversation, you'll be able to check against the objective whether the program was effective. You can do focus group discussions or in-depth interviews. You can do a story of most significant change, which can also help you to know whether the program has accomplished its objective, or an outcome mapping. For example, we have the school feeding program. What percentage of the targeted schools received meals, right? And as student attendance improved in program schools compared to the original log frame targets? These are some of the things that you can be able to use to target to evaluate effectiveness of your program. Then we'll talk about efficiency. Efficiency is about how well are the resources being used. You have resources that you have gathered for a program, you got funding, you got human resources. Did you use them very well? Are the inputs proportionate to the output? You spent $5 million on a program. The result should be sure that you get at least maximum value for money. Could we have achieved the same result at a lower cost? Or are there alternative delivery approaches that will have been more efficient? What is the cost per beneficiary reached or unit of output produced, right? So this one wants to say, did we manage our financial resources very well? Could we have gotten the same result with lesser resources, right? So you can carry out a cost efficiency or cost effectiveness analysis. You can do a value for money assessment. You can do resource tracking and financial review. Benchmark against comparable programs, maybe other programs that have been done in the same area or similar area. You can benchmark your program against those ones. Did they achieve the same results with the same amount or lesser amount? Because you don't just collect because you have funding, just be spending money, You want to be sure that this program has accomplished the goal at the best, at the maximum utilization of resources. And as an evaluator, as an evaluation consultant, a specialist, this is another question you should ask. Has this program been efficient? For instance, let's say we have a wash project and the cost per household for accessing clean water is $220. You can say similar projects in this region. How does this compare? Is it that they spent, the cost per household was lesser or more? Or if you have a community-led construction program, maybe you involve community members in building this borehole, would we have spent lesser money, right? Because the goal is to ensure that you'll be able to achieve the result at minimum cost as possible. That is talking about efficiency. Then we'll talk about impact. Impact says, what difference is our intervention making? What are the long-term effects attributable to the program? What are the unintended positive or negative effects that have occurred? And to what extent can observed changes be attributed to the intervention? Or what could have happened without the program? That's establishing a counterfactual, right? Okay, let me say it again. Whenever you carry out a program, apparently there's a problem that you have observed in the community before you carry out your intervention. Now, having done your intervention, you now check, in the next 2 years, 3 years, what difference has this program made eventually, right? To be able to carry this out, you can do a quasi-experimental or an experimental design where you have a control group and you have an intervention group, and then you have a baseline and endline evaluation where you have, before the program starts, you measure both the baseline and the endline group. And at the end of the program, so you measure both the control and intervention groups. And at the end of your program, you measure both the control and intervention groups. Then you now compare the volume of change. Has there been any change at all in the intervention group? And then in the control group, has there been any change? If yes, the magnitude of change in the intervention group, is it the same as that in the control group? That's why we talk about the difference in difference analysis, right? They'll talk about the contribution analysis or theory-based evaluation, propensity score matching, case studies, and longitudinal studies. An example, let's say we have a microfinance program for women, and beyond household income, we want to see, has the program affected women's decision-making power, women's decision-making power, or what are the unintended effects of the program on household dynamics, right? All right, so the last item will be sustainability. Sustainability says, now we have done our program. Will the benefits of the program last after the intervention ends? I've been in a lot of evaluation programs, like I told you. There was one we went to do in Yaba area, Yaba, Ebutemeta area, a Save the Children program. Then around 1990, in 2020, 2018, 2017, thereabout. So it was a WASH program. When the program was ending, the community members were saying, we love this program. We want it to continue. Unfortunately, the program is ending on the side of the implement of the program of the donors. Same thing I get to see again and again. If you go to different programs, Northwest, Northeast, North Central, Southwest, Southeast, across different states that I've been to, as we are doing the evaluation, they'll say, we love this program. We want them to continue. We let them to not stop and not do stop. But whereas the implementer are saying that we are leaving, we hope that you have been able to learn the lessons and adopted the techniques that we have given you. And their hope is that this program will be sustainable. Their hope is that the intervention, the changes that have come as a result of the program will last and will not just end. So the question is, what do we do? One of the ways to do this is that as you are designing your program, you must design your sustainability into the program. So you don't just design the program, you also design how will the benefit, the influence, the impact of the intervention continue after the program ends. Because if it doesn't continue after the program ends, then the program effort has been wasted in the first instance. For instance, will financial and institutional mechanisms sustain the benefits? You have done the program, you have trained young people, you have you reduce cholera outbreak. The question is, how will you make sure that the people do not go back to drinking dirty water by the time the program has ended, right? These things must be carefully thought about and implemented in the program right from the outset. For instance, one of the ways this is usually done is to ensure that local actors, there's a buy-in from the local actor, from the community members, from the government. If there's a buy-in, then it is able to, the probability of the sustainability of the program is surer. For instance, there can be community ownership where you hand it over to a community action committee who are now able to continue the program because they have seen the benefits, or the local leadership like community leaders. So as an evaluation specialist, these are the questions you want to ask. Are there environmental or social risks that threaten the sustainability of this program? Now, what are the dimensions of sustainability? in talking about sustainability, we talk about financial sustainability. Will there be continued funding for this program? Because some programs, they need funding to run. So one of the secrets to managing the funding aspect can be that people can pay a token so that the program can continue. Maybe you do the free education program, you see the benefits. Now you now say that, okay, as you are leaving, you people pay a token so that you'll be able to reduce most of your costs and the program be able to continue, right? Or institutional sustainability, where there's a structure in place, there's a system in place. You are handing over to a particular person or group of persons who will be able to run the program after it is done, not that it is done and it is ending. Or social sustainability, where the community, the cultural aspect, the social cultural system has adopted the program and is now seen as something that's of social benefit and can be continued. Now, talking about environmental benefit, your program should not harm the environment. If it doesn't work in harmony and peace with the environment, then it is not the good thing. It's toxic in program. So how can you evaluate sustainability? Data sources, you can look at sustainability assessment framework, you can do an institutional capacity assessment, you can evaluate community ownership, and you can do a community ownership and exit strategy review, or you can check financial sustainability model. You can talk with stakeholders on handover plan. Now you are handling this program, who are you handing over to? These are things you can ask during your evaluation program, right? Then, for example, let's say a community health volunteer program. When funding ends, will local health departments also absorb volunteers? People have volunteered, they have been going around, hello, want you to come and do this, and people have, the thing has been working, and you are giving them stipend. Now that the program is ending, the stipend is stopping. What will motivate the volunteers to continue working? Is there a government budget or community financing mechanism to motivate them to continue working? Or you are working with these people that HIV, there's a name to call them. These people that do community HIV sensitization. These are people living with AIDS that go ahead and volunteer to talk to other people, right? All right, so I've talked about the 6 criteria. I've talked about relevance, coherence, effectiveness, efficiency, impact, sustainability. Where relevance is saying, are we doing the right thing for the people? Is it the right thing they need? Coherence, does this thing fit with what others are doing? Effectiveness, are we achieving the goals we set out to achieve? Efficiency, are we making good use of our resources? Then impact, is this thing making a real difference? And sustainability is saying, will the benefits last? So this is the main gist of the OECD evaluation criteria. And I would like to take a short break and get some feedback from you so far. Does anybody have a question or a comment or something that you want to say, or you think you are clear with it and all the stuff? All right, anybody, please. Okay, if your hand is up, please, you can talk. Mr. Gadiat, you can talk, please. All right. If I do not get any feedback, I'll proceed with the presentation. So we have 6 key insights. The question is, so the issue is that now all these criteria are should normally be considered in every evaluation. However, many times they have different relevance to different evaluation, right? So it doesn't mean that you have to keep forcing these things in, but you can weigh them based on the context of your evaluation and the donor requirements, right? Tensions sometimes you can have problems like, okay, are we talking about, when we are talking about efficiency, are we sacrificing sustainability because of efficiency, right? But no, you are not sacrificing sustainability because of efficiency. They work hand in hand to accomplish your goal. So if you want to carry out an evaluation, where do you start from? You start from relevance. Are we doing the right thing? That is where you start from, right? Then you now ask, is this thing, how does it fit with other programs? Of course, you can't evaluate effectiveness when you are just starting the program, when you are doing the formative evaluation, effectiveness may not be measurable at that time. But of course, you can measure relevance. Is it relevant? Is it coherent to the program? You may not be able to measure efficiency because you have not even carried the program, but you can evaluate for efficiency and program into your work. And then impact can only be done after you have done your program. And sustainability plans can be programmed right from the beginning. So how do you build a good tool for carrying out this evaluation using this OECD criteria? The way to go about it is that, number one, for each evaluation criteria, you should have a main question, and then you have at least 2 to 4 sub questions that operationalize the main question and make it measurable within the context of your program, right? Then indicators, you should go for measurable evidence, whether quantitative or qualitative, that directly answer the sub questions. As I ask your questions, where can we get direct evidence that can answer our questions? Your data can come from beneficiary records. You can do surveys. You can do focus group discussions. You can check administrative data. You can do observation, right? Then you can, for collecting your data as well, you can do surveys, interviews, document review, and all those stuff. And analysis of data will follow the kind of data that you're working with and the appropriate question. All right, so we're going to be applying this criteria now. I want to encourage you to get your pen. Let's apply this criteria for a scenario that we have drawn here. So we have a 3-year UNICEF program. Hello, are we together, please? Can I confirm that you are with me and we are making progress?
Yes,
all right. Thank you very much. All right. So we have a 3-year UNICEF program to reduce maternal mortality in 5 local government areas in Katsina State of Nigeria. The target group are pregnant women aged 15 to 49 years, and they are targeting 25,000 beneficiaries. The key activities were ANC, antenatal care, skilled birth attendance, emergency obstetric care training, community health volunteer deployment, and the budget was $2.4 million over a 3-year period. The implementing NGO was Healthbridge Nigeria, and the program ended 6 months ago. Now you have been commissioned as an external evaluator to evaluate the program. Now let me go it again. You have been commissioned to carry out. There's a UNICEF program that was for 3-year UNICEF program to reduce maternal mortality in 5 local government areas in Katsina State, Nigeria. The target group were pregnant women aged 15 to 49, and the beneficiaries were 25,000 target, right? Now, the activities include antenatal care, skilled birth attendance, emergency obstetric training, community health volunteer development. The budget was $2.4 million over 3 years, and the implementing NGO was Healthbridge Nigeria. The program ended 6 months ago. Now you are the external evaluation consultant that has been asked to come and evaluate this program. So for this program, we are going to write 1 evaluation question for each of the 6 OECD-DAC criteria. And we identify 2 data sources. And you can start writing the chat now. I will share my screen now. I will share this sheet. We're going to fill this sheet together, right? So let me go to my PowerPoint so that as I'm making the edits, you'll be seeing it live. So how do we go about it? Should we start now? Yes, so let's start with relevance. What is the main question for relevance? Anybody?
Is the intervention needed, sir? I think that's the main question. Is it needed for the people that we are going to meet?
All right, let me type it out. Is the intervention needed? Or we can say, is it a priority need for the people that we are doing it for? And how do we go about this? We will carry out, okay, so now we want to, okay, sorry, don't let me jump the gun. Let's continue step by step. You said, is the intervention needed? Is the intervention needed. Make it black and bold. All right. So, what are the sub questions that we can ask under this? In your 2, what question will you ask in your evaluation? Maybe you are using a focus group discussion or key informant interview or survey. What question will you ask your participants that will help you to know whether the intervention is met, the program met their needs or not? Over to us, please. Let me see the chats, if anybody's typing in the chat. Anybody, please just unmute your mic and type. Anybody? Please, are we together? One question you can ask is, can we see the previous page? The previous page. All right. Okay, so you want to see the program. Maybe what I'll do is, let me see if I can place them side by side so that you can, let me go to my screen and see if I can make it side by side so that you can see the two together. New window. All right. All right. All right. I believe you should be seeing my screen now. So I'll go to the previous slide and the next slide. I don't know, it looks kind of very small. All right, I believe you can see it now. Is it legible on your screen, please? Are you receiving adequate medical attention? Someone says. I said that this is the program. It is meant to provide for, it's a 3-year program to reduce maternal mortality. So, for instance, if you want to see, if the program is achieving its goals, is there even a problem? Did the problem address is maternal mortality a problem in the community? Was it a real problem before the program came? So you can ask the participants, say for instance, yeah. So you can ask the participants, was maternal mortality a problem before the program came? For instance, was it's too big. All right. Was maternal mortality a problem before the program came? Do you think the program met a significant need in your community? If yes, why? If no, okay. If no, why not? Because if the program did not meet a real need, then you are not supposed to be having the program in the first instance. So this would be an example of relevance. Did it meet a real need in the community, or you just feel like the funders just came to waste their money and to spend money on you, right? Let me see. Okay, so let's go to the next one. We'll be wrapping up shortly. So you can add more questions from your side once you get this framework. What are the indicators that you can use to evaluate relevance of the program? Anybody?
Yes, sir. You can check mortality rate.
What do you say, sir?
Maternal mortality rate.
Rate. Okay. What else?
Record
please?
review.
Record review. So this will be at baseline. So you can compare baseline. Is this thing does it have a strong prominence before the program started and all those stuff? So what are your data sources for this kind of evaluation?
Hospital records.
Mm-hmm.
ANC register book.
What do you say?
ANC register book.
Okay, I didn't hear that very well, but I heard ANC. I think under data.
Yes, I say ANC register book.
Okay, sorry, I couldn't pick intonation. You can type it in the chat.
I think it was referring to ANC register book.
Oh, okay. Then another source could be we can talk to the community members. You can talk to relevant stakeholders. Like, do you think this program really met an important need in the community? Or if it didn't meet an important need, then it's just a waste of effort, right? Then interviews, yes. Reports, yes. Thank you very much, Dr. Emmanuel. You can check reports. So what are the methods? Method will be desk review. That will be desk document reviews. When you are doing desk review, you are definitely reviewing documents. So desk reviews. Interviews, like I mentioned, interviews. What other things can we consider under this?
What of focus group discussion?
Focus group discussion, yes. FGDs and KIs, those are very good ones. FGD. All right, let's leave that one and move to the next one. So you can take time and populate it further from your side. Now let's talk about coherence. Like I said, coherence is this thing lining up with other activity interests of internal and external stakeholders? Let me bring the specific word I used here. Coherence says, let me go to my slide. Okay. Coherence says, how well does the intervention fit with other initiatives? That's the question coherence is asking. So let's come here and say, so let's go. What are the sub questions we can ask under coherence? Anybody?
Okay. We can ask, are there other organizations doing something similar to this?
Yes, are there other organizations doing something similar to this? Then what else? Any other person?
What are the policies that are available for this
What are the
intervention? Policies available for this intervention you want to run? Maybe there are government policies that you can.
Yes. What are the policies available for this intervention? Can help you to know whether you are in the right direction, so that you not just waste your effort. Does anybody have any more that want to add?
Okay. Now this is public policies, right? What about private policies, like the what's the name? The organization running the intervention.
Yes.
Their own key policies that they want to run with us.
Yes, that's correct.
Like that.
Yes.
Yeah,
So,
but why
you
not
can also ask,
10? You don't know
is this program how well does this program line up with the internal policies of our organization? Right? Okay, so these are questions that you should ask. So what are the indicators that can help you get answers to this question? Primarily, document reviews will help you to get answers to these questions. Excuse me, please. All right, excuse me, please. I think let me attend to some of our participants' questions here. Just want to make sure that as much people as possible. We'll soon be running up. The goal is not to run the conversation forever. So let's make it ASAP. All right. All right. All right. I think that is suited. Okay. So back to the question. We talk about indicators. What are the indicators that you can measure to evaluate coherence? Anybody? Number of similar programs running in the target community at the same time. Availability of existing ability of related policies, government policies, or programs related to the intervention, and on like that. And your data sets will primarily be a desk review. As an evaluation specialist, as a consultant, you should be able to go over the documents of the organization you are consulting for to say, okay, what are their priority goals, so you can evaluate for internal and external environment. Policy documents will be your primary. Policy documents will be your primary data source. Policy documents, program, and all those stuff. So method will be primarily a desk review. Desk review, or you can do interviews. Interview relevant stakeholders. KIIs primarily. Interview with relevant stakeholders. They are the ones that will tell you, this program lines up with existing interest areas and they are doing well on all those stuff. Then, are we together, please? Someone's mic is on and interfering. Yeah, I'll attend to that now. All right, please, if you are not talking, you can help us to mute your mic so that we will be able to. Let me get that out of the way. Let me figure it out. Who would that be? Okay. I'll mute it now. Okay. Let me mute it on my side, please. Excuse me a moment. All right, fixed. Thank you very much. So we're talking about effectiveness. Let somebody tell me, what did I say effectiveness means? Anybody who can talk to us? What do we mean by effectiveness? You can unmute yourself and talk, please. What do we mean by effectiveness?
Besides effectiveness, is it achieving the goal that was stated that needed to be achieved?
Yes. It's stated goals primarily. The program. So, what questions can we ask to evaluate for effectiveness?
So I think we can ask, was mortality rate reduced?
Okay. Was mortality rates reduced?
So that's a maternal mortality particularly.
Yes. All right. Okay. What other questions can we ask, please?
We can ask for the present rate of maternal mortality and compare it with the at baseline, maternal mortality at baseline.
All right. What is the current level of maternal mortality compared with baseline? All right. I will allow us to add more on our side when you get the toolkit. So what are the indicators that will help us to evaluate for effectiveness of our program? Maternal mortality rates.
Yes, sir. Yes.
Maternal mortality rates. Just go and get the data and help you to know whether what's the maternal mortality. This is simple, and then like that. All right. So our data sources, we include records, M&E records, hospital records, then interviews will still work, then program document, other documents. You can still fill more as you find it relevant to whatever you want to accomplish. And what are the methods? Primarily, you do a desk review. Then you can do interviews. Funny enough, even community members can be able to provide answer to this thing based on their own evaluation. So not only KIs, but FGDs as well, and also support the answer to this one. Then we go to efficiency. So who wants to talk to us about efficiency?
Efficiency was,
yes, sir.
Yes, I can say, how well did the program use the resources received?
All right, so we need sub questions under efficiency.
We can say, what was the cost of the implementation of the program?
Mm-hmm.
And then what was the cost of the implementation of a similar program in that same locality or in a similar locality?
Yes.
Then
yes.
Could the costs have been, or could the same impact have been made, or no?
Could the same results have been achieved?
The same results have been achieved with less cost?
Yes. Yes. We want to see, could we have gotten this thing done with lesser amount of money? Right. I actually want to point out something. This criterion shows you that you don't just do a program without thinking. In fact, your evaluation is not just done spuriously. You are required to take conscious, careful and conscious thought into what you are doing, so that you can be sure that, okay, we are measuring the right thing the right way at the right time, and we are being efficient. If you're able to accomplish your program efficiently, and as an evaluation consultant, if you are able to measure this thing accurately for the client, they'll be able to say that, okay, this is what we're doing. Or as an M&E specialist in an organization, we say, okay, as an organization, this is what we are doing, this is how we are performing, and be able to inform whether the program is going to receive subsequent funding, or to know what to tweak or to review in the continuation of the program. All right, our indicators for measuring efficiency, that will basically be the financial records, the M&E data source, M&E data. What other sources can give us information for efficiency? Anybody? Okay, I'll allow us to respond to that at our time. So the data sources, like I said, will be the financial records primarily. Then you can talk about the outputs, the things that were distributed. What the M&E records should give us all those of M&E records, M&E records. You know, I'll tell you a funny story. When I started using this framework for program evaluation, I told you around 20. So we had the question on efficiency, and we were asking the community members, they could not answer the question. And I'm like, why do you even put this kind of question in this tool? This is not their question to answer. It is the people that are in the know of the distribution of resources. However, the only way the community members will have been able to answer would something like say, did they receive X, Y, and Z, or do they think the program was wasteful? Yeah, maybe the community member could say that this program you have seen, do you think the beneficiaries now, do you think this program was wasteful? Do you think they gave you more than you needed? Or do you think what they gave you are doing the program, you now give all these primary school students laptop. You did not give them small laptop, you gave them 12th generation laptop and very high-end touch screen, very fragile materials. That's not efficiency. It is not efficiency because children can just drop the thing and to get spoiled within a short period of time. You can even ask the teachers, do you think the resources for this program were efficiently used? If you say, okay, what do you mean by efficiently? Like, did they maximize the value? Do you think they were wasting money? So that you can now triangulate it with other data sources. Look, was this thing well done? Right? So I will include interviews. Originally, that time I really didn't understand it well, but if I think I have to do it again, I must still include it and like that. So desk review, like I said, includes evaluating all the existing project documents. So we'll talk about desk reviews. Then interviews. Interviews, like I said, I will include key informant interviews. Just that the kind of question you'll be asking them is different from the question you'll be asking those that are internal key stakeholders. Now let's talk about impact. Anybody who wants to talk about what do you mean by impact? Impact is saying that what difference does the intervention make? We have done the intervention. You say that it's relevant, but what is the real difference that it is making in the community? So let me put it as, what difference is the intervention, does the intervention make? So what are the questions that we can ask under this? Anybody? Just one or two questions that we can ask under impact. We'll soon be rounding up.
What is the value of change that was seen or that was
Say it again, please.
The value of change, I don't know how to put it. The people that were impacted. What is the value of people that were impacted?
All right.
Because we had 25,000 people that we needed to impact with this program. Was it actually impactful? Did we meet the goal that we needed to meet? I don't know.
Let me give you a more specific example. You can say that, before the program starts, they can say, in this community, 1 in 3 women die while giving birth, right? Start to see, let's say 1 in 3 women, or 2 out of every 5 women. Is done is the situation before. These things usually be tied to the objectives, to the key indicators that have been specified in your program. Let me see. So for our work, the activities include ANC skilled birth attendance, emergency obstetrics,
All right, everybody. I'm so sorry. I realized that I lost my connection. Please, what was the last thing you heard me say? Hello, everybody.
We were talking about necessary questions to measure the impact of a particular intervention.
Okay. Okay. So questions first. Impact. Oh, okay. All right. I realized that I lost my internet connection. All right. I think for this time, while I'm trying to get my computer back on the internet, let's proceed. I don't know why I had to lose the connection. Let's proceed. So I was saying that if we talk about what difference is this program making, right? And we can ask, the more women attend ANC, as the community attitude towards ANC improved, or to what extent as maternal mortality reduced? And then the indicators to use to check is maternal mortality rates. We can set ANC attendance, stuff like that. All right. Then you can get your data from NDPS, desk use, or you can even do interviews or carry out your service. Please, if you're not talking, you can kindly mute your microphone. Mr. Katia, I will need you to mute your microphone. My internet is not connecting still. Right, let me see what I can do about that. All right, I'll soon be able to get back on and then we'll be able to continue that area. Then, so next includes lastly, we're talking about sustainability. I was sharing my screen. When we talk about sustainability, what do we mean? Everybody. Everybody, please.
So it's like your audio is still not clear enough.
How is the audio now, please? Can you hear me?
Okay, yes, we can hear you, sir.
I think it's better.
Unmuted. No, you're muted now, sir.
All right, thank you. All right, I think I'm audible now. What do we mean when we're talking about sustainability? Sustainability talks about whether the program is able to continue after the intervention has ended. Please, am I audible? Hello?
Yes, sir.
Yes,
All right.
you are.
Thank you very much. So sustainability says that the program has ended, the funding is done. Will the program continue or it will end, right? So let me enter the sustainability part. Sustainability says, but not only will the program continue, we're also saying the benefits that the program has brought about. Will the benefits last, right? You have done a program, you have reduced maternal mortality, more women are now giving birth in the hospital and all those. But the question is, after you are done, will the situation go back to where it was before it started? Because if it does, then your program has not really done a lot of work. Because it's one thing to have a lot of impacts, it's one thing to have a lot of internal benefit, but it's another thing for the gains of your intervention to continue after you have left. And I remember I mentioned 4 areas of sustainability: financial sustainability, environmental sustainability, institutional sustainability, and social sustainability. So the question is, will the maternal mortality rate remain low after the program has ended? Will Will women continue to attend ANC? Will the volunteers continue working? How will the program be funded? Going forward. So sustainability is actually asking, what is the way forward? We are done. So what are the indicators that you can use to measure for sustainability? Community buy-in. We talk about existing available sources of fund. What else? Then we talk about community adoption. We talk about government support. If government should release a policy document to support a program, you have really achieved a lot. Government and etc. Right? So to get information about sustainability, you can talk to different stakeholders to know what is the program in place. Interview different stakeholders to know what is the situation. Is this thing going to last? Is it going to run? Community members may tell you to run based on their attitude, but the people that will drive the thing, the relevant stakeholders are the one that can really tell us whether the program will run after it is over or not. So this is just a sample, and like I mentioned to you earlier, this framework will be shared with you so that you can be able to practice with it first of all and use it in your next evaluation exercise. So as we wrap up, I'll talk about some common mistakes that people make in evaluation. So you can confuse output with outcome. Output is the things that you produce in the process of your evaluation, the number of trainings that you conducted, the number of ANC sessions that were carried out, number of items that were shared with people, and all those stuff. Whereas outcomes are the result of your activities, what's now happened because you did X, Y, and Z. So don't mix the two of them together in your evaluation. Then don't ignore your theory of change. I think what I should do is to show you a sample. If I'm going to do an interview guide, okay, when I'm done with this, I will show you a sample. Don't ignore your theory of change. Evaluation without a theory of change means there's no basis for judging effectiveness of your program or tracing impact. It is rare. Don't treat attribution and contribution as a program. You can't just claim that our program is the only cause. There are a lot of factors that run together at the same time. So you can't just claim the sole cause for an outcome that you identified. You can contribute. You can do a contribution analysis to show your program's role alongside other factors. Don't neglect unintended effects. Unintended effects can be positive and negative, right? But they also count as impact. An evaluation measuring only intended outcome is incomplete. You should also mention what are the things that happened as a result of what we did, but we weren't planning for, but they happened all the same. They can be positive or negative. And lastly, don't overlook coherence. You must always mark your program to the broader ecosystem of initiatives and policies. So at this point, I want to do a live demonstration. I want to open a Word document. I want to show you an example of what a tool to measure this thing will be like. Let me see. Let me share my entire screen. All right. So when we are doing our slide, so let's say end line evaluation, or let's say impact evaluation of maternal mortality program in Katsina State, carried out by project partner Data Solutions. So The two we are doing now, key informant interview for let's say program officer. So we now say we have 5 criteria, right? So you have to have your 2 questions for section A, relevance. B, coherence. C, effectiveness. D, efficiency. E, impact. And F, sustainability. So the first question you ask is okay, we have written our question here, so I can just copy them. Just copy them and paste them here. If no, why not? Under coherence, we have we can ask how well does this intervention fit the need of the people or something. Then you can ask the sub questions as you wish. And on and on and on like that. So this is an example of how you can structure your tool for an end evaluation. Then you can also always ask for recommendations. It's important. You'll be able to know other things that will be important for pushing your program, post implementation, and all those. So, as we wrap up our conversation for today, I want to say that these are 6 key takeaways that you should go home with. The OECD-DAC criteria are global standard for development evaluation, and it is used by every major donor and implementing organization. There are 6 criteria: relevance, coherence, effectiveness, efficiency, impact, and sustainability, and each of them answer a distinct question about program value. Coherence is the newest criterion and assesses how well the program fits with other ecosystem of initiatives. You should always build evaluation questions before choosing method. The question determines the method and not the other way around. Attribution is rarely possible in development, so use contribution analysis to demonstrate your program's role in observed changes. And lastly, sustainability should be planned as design stage, not evaluated at the end. Build handover and exit strategies from day one. All right, so this will be the end of my presentation. Do we have any question? Question. Do you have question from anyone? Is there something I've said? You can use the chat or mute to ask your question. Yes, Mr. Onyekachi.
Okay, sir. Thank you so
proceed.
much, sir. Thank you, sir, for the question, for the session. It has really been very enlightening and interesting for me. So, but I want to, there's a bit of mix up in my mind, looking at the difference between effectiveness and impact. They kind of seem to kind of, I don't know, conflict in my mind. Like, how do we really differentiate effectiveness from impact? Yeah, thank you, sir.
All right. Any other question, please? Let me take the question so that we'll answer them at once. Any other question?
Sir, mine is about the sub questions. How do you know the right sub questions to ask for for your evaluation to be done, sir?
All right. So the next question is saying, how do you know the right questions to ask? Number one, like I told you when I started, I made mistakes as well. The first thing is start. And if you ask a question, you to be able to see where does this question, for instance, let me ask a question, let me look for a question. I'm asking a community members, do you like, how well do you like this program that was done in your community? This question I asked, What do you think it is speaking to based on what I just said? Do you like this program? Is it okay? Let me no. So it's what, sir?
I think relevance.
Yes, it's relevant because if the person says he likes it, that means that it is meeting their needs, right? Because if I say, do you like this program? It's not about sustainability. It's not a question of coherence. It's not a question of impact. It's not a question of efficiency. So definitely, do you like it? That it makes sense to me. It's meeting my need. Then it is a relevance question. Did I answer your question? So how to know it? Just ask, write down. Just pick any of the criteria. Once you understand it, okay, what question should I ask in my evaluation based on this particular area? Just see it as a framework. These are the key issues you should touch in your evaluation. I will answer Mr. Okoro's question now. If you have any other question, please drop it in the chat. He's saying what's the difference between effectiveness and impact. All right. So let's say we are doing the program for maternal mortality. Our objective is to administer, to share mosquito net, right? And when we did the program, we shared mosquito net. That is, we have achieved our objective, right? Is that correct, sir?
Yes, sir. Yes, sir.
Then the program is effective, that it achieved its objective. And we are hoping that the mosquito net that we shared, what do you think it will lead to? It will lead to cases of malaria, the reduction in malaria cases, right?
Yes, sir. Yes, sir.
Hello, sir. So if we now find out that there is not a reduction in malaria cases, then the program has had an impact.
Okay.
So did we achieve the objective we set out to achieve? That is the effectiveness. The impact is the outcome we are hoping to see from our objective. Did the outcome come to pass? Then we are talking about impact.
Yes, sir. Okay. Okay,
all
sir.
right. Thank you very much. All right. So somebody is asking if the recordings will be available. We have decided that we will not be releasing the recording. However, from what I've observed, a lot of people are not able to join. So this is what we're going to do for a limited time, maybe like for the next 48 hours. We'll make the video available on our YouTube channel, but it will not be, it will be on a private link. So we'll send the link privately to all participants for a very, I think you have the link in your email already. We'll make this, you'll be able to view this video again for the next 48 hours. Today is Thursday, so by the end of this weekend, afterwards, it will not be available and it will not be available for download. So if you want to review it, you can go ahead and review it. We'll be sending you a post-training evaluation subsequently to evaluate how well you have been able to follow it and what you think you will learn from it. Our organization, like I told you, is a training organization. We have an upcoming training for people that are especially in medical line on biostatistic health-related analysis, like how to do time to event survival analysis, chi-square analysis, sensitivity and specificity analysis and things like that, right? And I'm bringing my boss to come and conduct the training by God's grace. To be holding the month of June. We'll send you information about it very soon, and we are hoping that we want to enjoy you to not miss it, because this is something that I've seen over and over again. I work with a lot of our organization works with a lot of medical professionals. So we know that it's a recurring problem that people could not get when they were in medical school. So we want to solve this problem for people. And then in the second half of this year, we have decided that we are going to train people on how to really conduct a field research. How do you gather research assistants? How do you train them? How do you develop your tool? How do you go about and do community entry, right? All of these things are what we are going to be doing in the year 2026 from July to the end of the year. Every month we have different parts, and you don't want to miss it. So you can visit this link, ppdsanalytics.com/training. I'll share the link in the chat. You'll be able to see our upcoming training, our training brochure, and I really want to enjoy you. If you know anybody that's open to become a better researcher, let them join these trainings. Our goal is to empower you, to help you to be able to become better researchers and evaluators. So again, this video will be made available for a very limited time on our YouTube channel. Please go with it and learn and review while it is available. All right. So this will be the end of our conversation. The time is 12:29 p.m. Nigerian time. I think we made a good use of our time. So thank you very much. If you have any further question, you can send to the email. Mr. Oyekachi, your hand is up. If those willing to take all those classes, if you need someone to take all those classes, Ambassador. All right. Thank you very much, Mr. Timilene. This is greatly appreciated. Thank you very much. All right. My question is, can one extract part of the complex of the two to address? Yes, but I said that they have different weights, whatever the program you are doing. Right? They don't have equal weight. It's not all programs will require all the elements of the framework. All right. So you can also send us an email or contact us by WhatsApp to ask further questions. And these are other resources. These resources have been created. They'll be shared with you by email as well to help you to understand more about this topic. So till another time, I will hope to be able to bring this kind of thing again your way and wish you a wonderful rest of the day. Thank you very much.
Thank you too, sir.